Welcome to AFMC TV. I'm Robin Ledbetter.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults to were very creative.
Down on the floor and play with their kids.
AFMC TV, thanks for watching and have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Howell Foster, and he's the director of the Arkansas Poison and Drug Information Center and an associate professor of pharmacy practice at UAMS. Thanks for being here.
Thank you.
So, to start, tell us a little bit about your role at the Arkansas Poison and Drug Information Center and how your team supports both families and healthcare providers across the state.
Okay, well, I've been there for 32 years, so have a lot of experience doing this. We take a lot of calls from home. That's probably 65% of the calls we get and the cases that we have. The rest of those, almost a third, are healthcare professionals. And most of those are in the emergency department, and then a fair number of ICU type cases. And the vast majority of those are typically suicides.
And when people hear the word poison, they may think of like rare, even extreme situations, but how often are Arkansas families actually dealing with poisonous exposures?
You know, we take about 65 to 70 home cases a day. So, it's not a lot, but
That seems like a lot.
It's quite a few. We probably only get about half the cases in a given day. So,
And what are the most common substances that lead to calls from families?
well, the number one thing, and this is nationally as well, is acetaminophen. There is no close second. Acetaminophen as a single substance, we deal with it every single day.
Overdosing?
Yeah.
Taking too much.
Taking too much, it's common for, as an antipyretic for fevers in kids. And, they get double dosed and things like that. I was on the phones this morning, and I think I've had three acetaminophen calls already, one of them pretty serious. So,
In all ranges, not just children?
yeah, all ranges.
And we've heard about increases in accidental ingestion of things like button batteries, even cannabinoids in recent years. Can you talk about how those trends are impacting Arkansas?
Well, again, our numbers mimic national numbers pretty well, so our numbers are fairly similar. The issue with the button batteries are these batteries have gotten a lot bigger. So a lot of times whenever you flip a battery over and you look at the back of it, the first two numbers tell you how big the diameter is. So batteries that are 20 millimeters, 20 centimeters would be huge. 20 millimeters or bigger are really problematic, because particularly in kids, because it's hard for those to pass the pylorus, and they're more likely to get hung up. And particularly the lithium ones, those are much more dangerous than the alkaline ones usually.
Are there any poisoning risks that are more unique to Arkansas compared to other states? You mentioned that our stats are similar nationally.
They're similar, but we have some niche things that are problematic. And one of those things, this is for the farmers out there, is paraquat. We have a lot of rice and we use paraquat. It's an herbicide. Leave it in its original container. It is purple, usually in color. So people put it in drink containers sometimes. A mouthful is enough to kill you. So it is a very dangerous substance if you ingest it. It causes a lot of problems.
And nationally, there's been some concerning increases in intentional overdoses among adolescents. Is that something, too, that your center tracks here?
Yeah, we see quite a bit. Sadly, in the last 20 years, the suicide rate in this country has really gone up. We have a mental health issue in this country, and I don't pretend to know the answer to it. I just know that it's there and it's real. Or suicide cases in the last 20 years have tripled in young adults and into the late teens, but it's gone up 700% in children who are 12 years of age or less. So that's a pretty shocking statistic.
And most of those are due to poisoning.
Oh, all of them are. All of the ones that we are dealing with. These are typically self-induced situations with, most of the time, medications.
So what does research and surveillance tell us that we should do about prevention efforts? Where should those be focused the most?
Well, at home, from a family standpoint, one, don't leave medicines in lower places. This is more for toddlers. Keep them up, keep them out of sight. Don't call them candy, those types of things. For toddlers, when you walk out of the house and into the garage, the risk goes way up as far as how dangerous things are. We get into fuel additives there, so methanol, you have ethylene glycol out there, you can have herbicides and pesticides. In the house, typically other than medications, drain cleaners are the thing that I worry the most about. So.
And many primary care providers may not realize how often poison control is consulted. So what role does your center play in supporting clinicians and even emergency departments?
Well, we're specialists in what we do. We have 6 toxicologists on staff, 3 medical, 3 clinical, and then the rest of our professional staff are nurses or pharmacists. So have a lot of, professional ability there. And if you think about it like this, if something is even relatively rare that you only deal with statewide, you deal with 15 cases a year, as a practitioner, chances are you may never see one or only see one in your entire career. And we see them at least with some regularity, so we have a little better, depth of knowledge on those substances or situations. So, we can be a really good source. Data also shows us that length of stay in the hospital is less when you consult the center, and antidote use is more efficacious and we use it more efficiently. So we typically use less than if you don't call the center. So.
And are there common exposure risks that PCP should be counseling families about?
Again, it's keep the medicines up, those types of things. Don't, instruct families not to call things candy. It's easier to get the child to take the medicine if they think it's going to taste good. I get that. But, we need to be diligent about those types of things.
Even things that could be conversations in a well visit.
Right, correct.
And what are some red flags providers should watch for that may indicate poison exposure, especially in children who may not be able to communicate?
Are we talking about providers or people at home?
I mean, it could be both.
Okay. Kids, obviously, small kids, they always can't tell you what's going on. So any radical change, mentation, things like that, you don't have a good explanation for. Maybe they got into something. I will tell you, 2 nights ago, I was on the phone. We had a child go into grandpa's room. He comes out, and half an hour later, he's lethargic. And we're not really sure what he got into, but he definitely got into something because he got airlifted from a rural area in Arkansas to Children's. And we have comprehensive toxicology drawn on him now, but we still are not entirely sure what he got into because nothing has showed up. And his symptoms didn't quite fit what Grandpa was on medication-wise.
How can collaboration between poison control centers and frontline healthcare providers improve patient outcomes?
Well, the more we share information, the better off we all are. And we're a repository for things. We can't do clinical trials on people because we can't poison them. You're not going to get that through the RRB. So the more data you have and the more cases you have, the more robust at least that type of data is. And, that helps everybody.
If there's one misconception about poison exposure that you'd like to correct for both general public and healthcare providers, what would it be?
Don't believe Dr. Google. And, don't assume things because there are a lot of things that sometimes I will hear people say, oh, that's really poisonous. And it's not. Or conversely, things that you may not think are really dangerous can be really dangerous. And one of those, from a prescription standpoint, and this time of year it is something that we see pretty commonly in pharmacies, is benzonatate, which is a brand name Tessalon Pearls. It's an antitussive, so for cough. I dispensed those for years when I first got out of school, never knowing how dangerous that substance was. This isn't for the lay public out there, but for the physicians and providers that are out there. It is a potent sodium channel blocker. So whenever you think about that, where do we have a lot of sodium channels? Heart, brain, nervous tissue. You can have seizures, you can have dysrhythmias with it, and it does not take very many. I will not say the location within the state, but within a few years ago, we had a 13-year-old. I think it was just a suicidal gesture. I don't think it was really an intent to kill herself, but she succeeded by taking this product and maybe only took 12, 13 little capsules. So
A very commonly prescribed med.
yep.
So before we go, when should families call poison control versus taking someone directly to the emergency department?
You know, if somebody is obviously not breathing, things like that, you need to call 911 first. But call us beforehand simply for this reason. One, we might be able to tell you a few things to do before you get there, and we will call ahead to that healthcare facility if you want us to. We will give them a history so that whenever you come through the door, it speeds up the process for you.
And what is the poison control 911? How do they get to you?
So there's a national number. It is 800-222-1222, and a lot of twos. That will route you based on your area code. So the problem with that is if you take an Arkansas cell phone to Florida on vacation, you may get the Arkansas center when you really need the Florida center. The other thing is, and I will throw another number out there, is 800-376-4766. That was our number before we had the national number, and we've kept it. That will reach the Arkansas Center from any state or any U.S. territory.
A resource regardless of where you are.
Yeah, it's interesting. We don't get a lot, but we still get calls from overseas on military bases from individuals that have our Arkansas cell phones. So,
And 24/7
24/7,
available on
we
the
never
line.
close. There's always somebody there to pick up the phone.
Well, thank you so much for being here today, sharing this important information. I appreciate you.
No problem. Enjoyed it.
And that's it for this episode of AFMC TV. Thanks for watching and have a great day.